Good evening, everyone. I'm Dr. Nitin Agarwal, physician and a consultant diabetologist. Diabetes is a leading problem in India now, since we have 74 million diabetic patients right now, and this is going to get double in next 25 years. That it is expected that by 2045 we will have around 134 millions of diabetic patients. The problem is 50% of our diabetic patients are poorly controlled. Many are still undiagnosed. And the HbA1c control is very important. It has to be between 6.5 to 7%. What happens if the sugars are not under control and the HbA1c target is not achieved? So the diabetic patients are prone for long-term complications, like they can have both microvascular and macrovascular complications. As we know that diabetic patients are 3 times more prone to have heart attacks and 5 times more prone to have strokes. So what are these macrovascular complications? These diabetic patients, they get cardiovascular diseases which lead to heart attack. They also have cerebrovascular accidents, that is stroke, and they also get their kidneys at risk because of the vascularity, atherosclerosis, and uncontrolled diabetes can lead to renal failure, and they become dependent on day-to-day dialysis, which cost a lot of economic burden on the patient and also on the government. Then they are also prone for more eye related complications like cataract, glaucoma, and their retina is also at risk of developing diabetic retinopathy, which can lead to blindness. In many patients, they have two types of leg related problems, like they have neuropathy as well as sometimes the vascularity is compromised to the legs, which can lead to amputation of either a toe, foot, or the entire leg, which can lead to a permanent disability for a diabetic patient. Apart from that, because of neuropathy, they lose the sensation in their limbs. Sometimes it is just tingling, numbness, which can disturb their day-to-day life, and sometimes it may lead to a complete sensory loss. So this loss causes, sometimes minor burns, which gets infected, and later on that wound doesn't heal for a long time. So many of them, they suffer for long-term infections of the leg, which can lead to amputation. Apart from these complications, there are certain other microvascular complications which can damage other organs in diabetes. How to control or how to educate the people regarding this? You have to have a diet which is rich in fiber, and it should be healthy diet. You should reduce the carbohydrates. India already consumes a lot of carbohydrates. The Indian people are dependent on carbohydrate rich diet, which leads to high rate of diabetes. So you have to reduce the carbohydrates, you have to reduce the fats. So how else you can improve your diet? You can increase the fiber, you can increase more vegetables, fruits. Some of the fruits definitely are really healthy in diabetes, which have less glycemic index. You have to choose certain fruits for your regular diet. It has to be consumed regularly. You have to exercise regularly, daily a brisk walk or other rigorous exercises like hitting a gym if you are young enough, or swimming. It all helps. A sound sleep of at least 7 to 8 hours, minimum of 6 hours healthy sleep is also helpful in reducing your sugar levels. Also, the stress levels increase the sugar, so you have to have a stress free life, reduce your stress by doing yoga or regularizing your routine so that you can have less stress. Apart from these, it is very important to take your medicines regularly, have a regular health checkup, keep your sugars under control. If they are not under control, you can consult a specialist doctor, and you can ask them for a better choice of the drug, since today we have so many modalities of the treatment that diabetes we can reduce, and so that we can help in becoming a better nation, since by 2045 it is very difficult, otherwise we will become the leading country with the diabetes cases. Thank you.